I'm just going to summarize in simple terms for layman listening to this podcast. So the main question is that, okay, so when I have to remove the glass, it is not as simple as what you think. Basically, somebody needs to evaluate in terms of how much strength your cornea has, what is the exact refractive error, and based on that, we have multiple laser techniques that you said. And I think it is better that patient can go to a tertiary advanced care center like Center for Sight to determine exactly what they need, and rather than choosing what is available in that center for the patient. Will you agree?
110%. You do not fit a procedure on the eye. I mean, it's not that I have to fit the same procedure on any eye. You have to choose the procedure that best suits. Now, for example, you talk about this, but then you have minor things. For example, I can go and buy a coat which could fit me, or a shirt, a 40 number shirt, but I can have it tailor-made. So my one arm or my one shoulder may be a little higher than the other one. My arm may be different from a regular length or whatever it is. So even the finer abrasions or finer refractive errors which could be there are mapped. And then this goes into, say today in Foresight there is artificial intelligence that comes into way, that how you work on the cornea to get you the best without wavefront the eye. Okay, so how to correct the maximum amount of wavefront deformation that is there. Now, what is important? Data collection and firing of the laser exactly on from where you have corrected the data. So where does it come in? You get eye trackers. Okay, so you have a 1000 Hz laser, which is the fastest laser on the planet Earth, excimer, which is firing at 1050 Hz. That means it's very fast, the laser is firing. And it has to have an eye tracker which is of the same speed, 1050.
Wonderful. All these are good for the patient.
Oh, sure enough. So the patient has to, it's not that I can do a wavefront deformation guided laser in all patients. If you have a high wavefront deformation, the 3rd, 4th, 5th order deformation, then I should do it, because it can, if you are trying to correct a lot of deformations which are not there, then you can have a residual power, etc. So please, one thing is that there is a expertise, there is a science, there is a wisdom that goes into it to plan. And it's not that I have one machine and I say that this is the best. It is utopia. It's about it. Generation after generation, things have kept on improving. Every company parrots its own machine as to being the very best. But you should choose a place and a doctor where you have all the technologies, the wherewithal to even manage complications, and the wherewithal to decide as to what suits your eye the best.
Wow.
And then you will not be grieving about going in for laser vision correction.
Super, sir. Was wonderful. Was such an amazing discussion. If you want to leave our audience just with one last message, what would you say?
Eyes are the most wonderful gift of God. Preserve them, look after them, and we'll take care of your eyes, because every eye deserves the best.
Follow Center for Sight and post your queries to get answers from the experts.